send in a word through this Menti.com on your phone or your device, just to describe one word that describes successful local change to you. And we'll see what you have to say. So already we see a few words up there. And the whole conference is around think globally, act locally. And sometimes the act locally can be really hard. Like, what the heck are we supposed to do? There seems to be so much. Where do we start? And can be overwhelming. There's just so much. Sometimes the politics scare people away. My daughter just finished a psychology class. She says there's something we learned about bystanders. You know, we get caught up in the bystander mode, and we end up just witnessing, which in itself can be important, to witness truth, especially for Indigenous people who are fighting for land or watershed health. And if you're a bystander, there's often no action. And it's a psychological phenomenon she was sharing with me in her book that she was reading about in her studies. And it's often with bullying. People will witness a bully. And sadly, I've seen that the Peace on the Land protection for water, that the Wet'suwet'en hereditary system has been going through for decades now. And we stand up, and we had to decide that we cannot be a bystander when the land and the Yinta is being harmed. Because when you harm the land, you harm us as a people. And so that's been a huge learning experience for us. And I'm just going to try and pull up my photos here.
That'll mean that we need to stop sharing the Mentimeter briefly, Christina, and we'll pop it up again at the end if it's okay.
Okay, perfect. Okay. And just a quick note for the other Mentimeters. So I see some people are putting in words in the chat box. To be able to participate in the Mentimeter, you guys need to go to menti.com and use the code at the top of the screen, 18233, and then you'll be able to input your answers there. So I believe when I end screen, I'll still have this one open. You guys can include your words, and then when we go on to the next one, it should be the same code, and you guys can continue to put your answers in. So I'll end the screen share right now and let you take over, Sandra.
And I think also if folks use their phones for the Mentimeter, it won't compete with what's going on the screen. And you'll find that easier to navigate maybe. So thanks for letting me interrupt. Thank you, Sandra.
Yeah, thank you. And so we've had a huge, huge learning experience. As I said, you know, we've been working to be land defenders in the court case. We've been relying on a lot of people to hold us up through that very difficult time. Show another picture. Whether we're sitting around the fire out on the land, we've had so many people come and visit, drop off food, just sit around and listen to the stories on why the Yinta is important. What is our creation story? How can we help? What can we do? Social workers, psychologists, lawyers, moms, dads, grandmothers, all kinds of people, students, so many youth showed up just to be at the fire, to provide support, sometimes as legal observers, to witness and to make sure there wasn't too much harm. And so it was so amazing. So we've seen this big global pipeline, this big effort to move through our territory, and our people come together right at home, right on the land. And it was incredibly powerful. It was very humbling. And it really brought us down from global to local in an instant. And we could see so much support, some criticism too, from all over the land. And so we're working through those challenges. We're listening, we're trying to hold each other up because it's extremely stressful. Taking care of our elders, taking care of the women and children who witnessed the awfulness of the police coming in and putting their mom or their auntie in jail. And so that's a little bit of a segue into action and local change, and how people can have a positive influence on the land, hopefully. And I'll stop sharing the screen now. I'll get back to the word cloud.
Yeah, thanks so much, Sandra. So we wanted Sandra to land us in territory for this session around local change, and where these words that we see, this cloud of words, the important theme of our session today is that local change lands somewhere. It lands, and it's when we take into account the kind of thinking from this summer school, when it lands, something will look, feel, smell, taste, sound differently. And we can hear the crackling of that fire, but we can also hear the conversations and the other dimensions of how local change can be experienced. So thanks, Sandra, for just grounding us. And the way that our session today is going to go is very conversational. We've had a lot of fun as 3 colleagues across Northern British Columbia challenged to capture this idea of local change. And we're going to have 2 rounds of conversations. We're an interactive panel, and you're going to be part of our fuel, because the kind of ideas that are coming through with these Mentimeter clouds and the other ideas we'll be calling from will fuel our conversation. So it's very emergent, and we're looking forward to being fueled by you. But we're going to begin with what we've referred to as sharing some origin stories of our relationship with local change, of our origin stories of creating local change, particularly in Northern BC, but elsewhere. And I'm going to return to Sandra first, who's going to speak, have another layer of thoughts around how the local change element is such an important dimension of your work. So over to you, Sandra.
Yeah, I'm just looking at these words here, grassroots, respect. Wachos is our word for respect, and it means being in good relations. It takes a lot of bravery and courage to stand up to big industry, to big companies. And I listened to our elders, especially Lucy Basil, who's passed on now. She was our oldest survivor of residential school. She says, we do it because we love the land and we love our people, and we want to be around for the next 500 years. And we can't have healthy people without healthy land. And so these are the things that we would listen to. We would come together as clans, as the 5 clans, Umbalaksilyu, Little Frog Clan, and just really try to hold up those visions, those words, those teachings that were all about sustainability, and that we have to do this today so that we have a tomorrow. And if we don't, we've seen so much devastation. We've listened to other nations that have gone through different projects. We've listened to and seen the data around population health. We've seen the harm from residential school, from epidemics, from disease that has still many of our people carry. And so we know that if we have this interconnectedness, I see that word up there, on the land, through our body, mind, and spirit, it helps us heal those wounds. And it helps us, I don't want to say recover, it helps us stand up in a good way. And we can lift up those teachings, the big love, the tabi infusai, the wakos, the respect. We can follow the path that our ancestors, our Notsadetni, had laid before us, and continue on that path. And our people have a vision that we have a healthy valley, and that there's a betterment and a good life for all people that live in the valley, not just the Wet'suwet'en people. You know, we're only about 25% of the population where we live. We don't have a whole lot of diversity where we live, I'm sad to say. But we are working very hard to come together. And how can we have sustainability? What is a watershed? What does our health look like as a people in Smithers or Houston or Burns Lake or Hagelgit or Witset or Wet'suwet'en First Nation? And trying to bring people together in a good way so that we can have these important dialogue sessions, engaging our youth, talking to our youth, been a phenomenal strength in all of this. And so, yeah, that's a little bit about what we're up to. Masai.
Masai, thank you, Sandra. And by having the conversation in this format, what we're going to be hearing is the diversity of our stories as three women who are really proud to call Northern British Columbia and different territories our home. Sandra's story is the longest in these parts, but the next person that will share a story of her journey to creating local change is I was trying to find the right adjective for Teresa Healy, and it's I had too many at once. The inimitable Teresa Healy, who has inspired so many of us and with her tenacity towards local change here and beyond. So over to you, Teresa.
Thank you. I was quite worried about what my origin story was, and it was through conversation with Sandra and Margot that I realized that I've always had a foot in change, even quite young. I grew up in a very poor family. I ran away from home. I traveled all over the world, but a lot as a flower child. So I came out of that generation of we wanted to be different. And arriving in northern BC, it felt like coming home. And I came up here in 1994 just for 1 year. And I'm still here, and that was in 1994. So it seems to me that I lived the determinants of health. Before I knew there were determinants of health, I realized the impact that poverty and food insecurity had on people's lives. I knew what it was like to be hungry on Wednesday and Thursday because Dad's pay packet didn't come till Friday, and the money just didn't last. So the flip side of the determinants of health for me was immigration. When I was a flower child, the Canadian, very handsome boy with this fabulous accent in a fringed jacket, he and I were together for a number of years, and he brought me to Canada. Turns out he's from a very wealthy family in Westmount. So you've got this backstreet kid who grew up Irish and Roman Catholic in the working class poor, suddenly in upper class Montreal. And something happened for me. I became white. I became English, and I got treated really well in Canada. And that wasn't the case in England, where somehow they recognize Irish and Roman Catholic. You were known. And so in Canada, I've been able to get this education. Even though I left school at 14, I started university, single mom with 2 kids. And here I am today with a PhD and a family who's not quite sure why I'm called doctor when I don't treat anybody. So the first in a large Irish family to go to university. And so the determinants of health have always been in a strong place in my heart. And I also have a real, affection's going to sound wrong, but being marginalized, I've worked with a lot of marginalized people in northern BC, and you couldn't meet friendlier, optimistic, caring, generous people than people who are living in poverty, close to or on the street, and living with HIV. So one of the things I really hope at this conference is that we're able to talk about people who live on the margins as part of the solution. And if we talk to people who are living on the streets about what safe housing is, and they trust us and we have relationships, they're going to tell us answers that are doable. So I think that I've got this, a foot in 2 worlds, still carrying some of the scars of childhood, but also now seeing those scars as a badge of honor. So I think that's my creation story. And so Margot, we should actually ask you for your origin story. So
kind of you to ask, Teresa. So we did have this really interesting recognition of the similarities and differences of what motivates our interest in local change. And one of the things we wanted to flag, and we'll come back to with Teresa as the Vice President of Public Health Association of BC, is that sort of what does it mean to then bring that, well, you'll be hearing us move in this conversation between our personal commitments and experiences, our roles as professionals and our roles as within our broader organizations. And we want you to hold that in your mind. And so my story comes from also a very personal place. In fact, I realized it's sitting over my shoulder, this image behind me that you can see behind my, you can hardly see it, but it is actually an image of the Taieri River catchment. In Māori, as I introduced myself in the watershed session, Māori introduced themselves with what can be considered a GIS, a verbal GIS, where you introduce yourself to your mountain. So in this image, there's a short image of Maungatua, the God Mountain. In fact, it's in the Taieri River catchment, but also my awa, not just my mountain, but my river. And the river here is the Taieri River, which quite honestly has been an extraordinary teacher for me, all the rivers and this river in particular, because of the multi-generational familial connections that my family has got over 150 years at the mouth of this river, living and healing and journeying and learning. And it's no surprise that my origin story, although it began in the spirit of confluences, I often think of myself as somebody who went to medical school in New Zealand, and my medical world, there was a confluence between my medical world and the rivers. Somehow there was this merging of both the experiential connections and the head connections. And so that combination of health through my medical training and the landscape through watersheds and rivers has continued to be part of the origins and that I carry through in all of the work that I've done. And that has included me having the good fortune to live and study in Europe and Belgium, but also particularly in Oceania, in Hawaii, in Ecuador, and then coming to Canada 10 years ago, where, what's more than 10 years ago, it's 15 years ago. I've been in Lheidli territory, living at the confluence, near the confluence of the Fraser and the Nechako rivers now for 10 years, and feel very blessed to have also been learning from the ways that when we lift our gaze as health people upstream, literally, that upstream is not just a metaphor, it is a place, and that we can lift ourselves upstream into those places that influence and determine our well-being, the living systems, the livelihoods, the lifestyles, the ways in which we are embedded in a product of our place, and in ways that resonate very strongly with many of the themes we've heard over the last few days. So that combination of the experiential and the cognitive, but that lived experience is something that we all bring to this local change work. And as you'll hear from in my stories, where the thread for me has been the way that landscapes and watersheds and rivers can be a place, a setting for us to think about health and well-being. So now we're really excited to move our conversation through into the next phase of things, and we're going to hand over to you, Sandra, for our next fuel from our group.
Yes. So we have another question that we would like to ask you. So on the Mentimeter again, we have a question. We are asking you to reflect on the opportunities that are available at this time for engagement, diversity, and/or local action. So Christina will get that posted up there for us.
There it is. And we're wanting, this time is in italics here, because we're really wanting you to think about this time in terms of what we've landed in this conference, this time of COVID, this time of the Anthropocene, this time of public health practice, interacting with new allies in ways that it's in another whole next generation of public health work. So we're really looking forward to your thoughts there. And to remind you that you can go to this menti.com, you can use the code, and you can add your sentence to the picture that we're looking forward to. Oh, there they are, starting to bubble up. That's exciting.
I only see you, Margot, which is not a problem, but
I mute I can see the screen.
I could try stop sharing and resharing the screen, and I'll see if that makes it pop up on everybody's thing again. So I'll just do that. 1 second, guys.
got it.
Oh, sorry, we're back again.
Oh, yeah, look at that. Readiness for change, choosing our recover, hopeful, talking in multiple languages, time of tremendous engagement of diversity. Change is inevitable. How do we deal with it is what's important. Yeah. All right, Teresa, do you want to get us started for the second round?
Yes. So at this point, we want to bring our stories to, that idea of citizen engagement, respecting diversity, political and social action in the time of the Anthropocene and COVID, that these two are colliding. And we really did want to think about this for its opportunities. And as you can see in the sentences popping up in front of us, there's clearly we have ideas, and clearly this group has the energy and the power to look at this moment, this epic moment in time, and how can we actually, as somebody said, bounce forward and not fall back in the tipping in that tipping point, that we go over to the next best thing. And so we each wanted to share a story of something that had contributed to local change. And I wanted to share a story that might seem unlikely, but it's from inside a health authority. And I was working for Northern Health and had been hired under a population health model to start a population health program with one other amazing individual. And the two of us have actually built and shaped a really important program within Northern Health. And one of the things that happened was a lot of different practitioners had little grants that they could give out. So injury prevention, you could get a grant for, $200 to do how to install a car seat properly. So what happened was all these individual practitioners were having to develop proposals and then screen them and then monitor the spending and then do the evaluation. So what we did was we created something called Imagine Grants. We made them very simple to apply for, and basically you describe to us what you imagine will improve your community. And they were for up to $2,000. And we were also looking at the fact that many northern communities can't compete for grants. There's organizations that have more money than the entire community budget. So we were looking at this as a way to learn about doing grants. But what happened that was so magical is that people took us at our word. And so one grant, for example, was for shoes. Children in the community were not attending school. They were taking turns because not everybody had shoes to go to school. And so they applied for shoes. And in one community, they formed a group called Hens and Chicks. And the hens were the elders, women elders, and the chicks were the young women. And they were working together. They were going to have a big community feast with all the food they'd grown. The hunters were going to give them a game to work on. But what happened was one night a guy got drunk and he pulled up all of the plants in the garden. Well, the hens and chicks got together in a circle with this guy, and it ended up that he became their greatest mentor, found them a better place for the community garden, and supported that group in such a meaningful way. And I think it's important to recognize that we do have allies inside of the big institutions, and that they too are trying to make change from the inside out. And that's just one small example. Those Imagine grants have grown as more people have come on board and putting money into it. So the Imagine grants are still going strong. And that's my story of how we can actually, even from within inside a big institution, engage with community if we shut up and let them lead. So that was my story. So Margot, you were going to share your story next, I think. You're on mute, Margot. Margot.
That'll shut me up. This idea of local change, and the fact that we're seeing examples where in our work we do need to recognize the combination of our role as citizens, as professionals, and in different organizations. And at this time, I think more than many, we've started to see that personal and professional meld as we've had to bring in our work into our homes, and we've also had to be reaching out from our homes into our workspaces and finding new ways to connect. And so my story is carrying on from the theme of the river and the watersheds, is actually my role as the co-chair of the Nechako Watershed Roundtable. So I'm a professor in health sciences who people think of as a health person. And in the last 10 years since I've been in northern British Columbia and working in the Nechako watershed, where most of my local work lands, I'm also involved in provincial and national and international work, but most of my northern BC work has landed in some way within the Nechako. So when I'm in my role as the chair of the Nechako Watershed Roundtable, I'm a co-chair. This is an entity that has been attempting to hold the space of a non-partisan, multi-stakeholder entity that is convening the necessary conversations to think about land-water interactions that engage with First Nations and that also engage with the local governance that needs to be mobilised to attend to these complex issues. The Nechako watershed is an area 1.5 times the size of Vancouver Island. We're talking about epic landscapes, and that's an area the size of Switzerland. And so what happens when, as we've seen in the chat boxes from earlier, what happens when we lift up and out into these landscapes of northern, rural, remote, provincial Canada, and we start to try to think of these dynamics interweaving? And so the challenge in this context in 2020 with the watershed work is that can we see that as public health work? I've always seen my work in the Nechako Watershed Roundtable as public health work, but that's not necessarily how others would see it. It is doing that unusual allies engagement of bridging across local schools, local people that are working and engaged with land and water protection and restoration. It's getting people understanding their places and their identities. And now in 2020, at this juncture, I add to the Anthropocene and the time of COVID to the right now time in British Columbia with the DRIPA, with the Declaration on the Rights of Indigenous Peoples Act in British Columbia, that is meaning that everything we are going to do, as we heard from Shannon and others, is going to need to be re-engaging in a new way with First Nations knowledges and perspectives. And when we convene our watershed roundtable gatherings, and we have provincial people, we have federal people, we have local First Nations, we have local NGOs, we have sometimes health folks, but it's difficult. It has been difficult to engage health folks when it's not absolutely part of their core mandate, and we're not talking about a particular drinking water supply, or we're not talking about a particular land hazard. But in fact, as we've been challenged in 2020 at this time, our local work and this local change action needs to recognise that the watershed work is indeed consistent with upstream public health work, and that there are whole new pathways, whether it's through the review of the Drinking Water Protection Act or through the impetus of the DRIPA Act and the holistic perspectives and engagements of First Nations, that watershed roundtable work can start to feel like public health work more overtly than it has in the past, when sometimes it's behind the scenes. So I'm excited. We've got time to be progressing, making these connections in new ways. So over to you, Sandra, with your story of this time and the particular stories we're experiencing.
Yes, thank you, Messiah Margot. The last couple of years with Molly and Frida and the families being removed off the land triggered a whole lot in our communities. And after the first round of people being removed, the local community said, is there a way we can come together and have these courageous conversations about how are we to live together? And what is it that you're fighting about? Like, what's the big deal here? And so, because we are in the North, we're a resource-based economy. It's a boom or bust. And we've been in a bust for a long time. And so this, proposed pipeline is seen as a way to lift a lot of families out of poverty. But what we've seen with a lot of economic development is that our people aren't often a big part of that. So the Union of BC Municipalities, the Friendship Center, the local Friendship Center, the communities, the chiefs, we decided to come together and have a courageous conversation about, well, what is it that we're talking about? What do you mean? Public health was there, the schools were there, the lawyers were there, the moms and dads were there, the youth. And to talk about, what is sovereignty? And what is the importance of history? Because we've had a denial of rights and title in BC for so long. And our population health has shown consequences of that. So we had 2 days together as a people in the Valley. And it was so amazing to talk about Indigenous ways of knowing, our deep ancestral ties to the Yintah, to our crests, to our stories, to our language, how those things all connect together and how they're so important for our well-being as a people. And to know that we're a generous people. We've been so kind with the settler population, with all these different systems that haven't necessarily been all that kind to us. And so how do we transform those things? How do we come together and have those conversations that one step at a time, we can rebuild, or we can build something new, can do something different, and we can speak to the racism, we can speak to the hardships, but we can also speak to the resilience and the kindness and the allyship. And so that's been amazing. And so that's an ongoing dialogue that I've had the opportunity to facilitate and be a part of, where I grew up in Smithers. So Tabi Masai.
So I think it's back to me, and we would like to put up the last question, please, Christina. We are, as you know, we're talking about local change, and we're here together from so many different parts of the world. The country. I don't think we've got outside of the country yet. But we are really interested now in the reason I got involved with PHABC in the first place was I went to a summer school, and I was blown away by this opportunity to talk about the things I cared about. And so ended up now on the board. And the board members are these amazing people who question and who think. And I learned so much at that table. And one of the things that the board's interested in is hearing from people in BC, not just the public health professionals, but from people in BC about what can we be doing to help you. We're not going to come into town and take over and, get on the front pages of the paper. We actually really want to think about what's supportive, especially given that, in northern BC, if you're a public health nurse, you're the only one in the community, right? So how do we support each other in making the changes happen that we see needed for public health and the well-being of everyone? So the question is, what if you wanted us to do something in the next year, what could we do that would be helpful to you? And that will build into the planning. And I would say that an example of PHABC listening was, for example, Chatter High. And I know Maureen, who is the real force behind this, is with us today. But that program, they go into all of the high schools and they put questions for the teens, for the kids in the schools, to think about future careers. And so PHABC decided, okay, this is a way we can start talking to the next generation and talking about the what public health is, because it's so mysterious to most people. And it's been amazingly successful. Another wonderful program, and Shannon's been behind this, is the vaccination program, where you actually go on and take quizzes, and if you earn points, then I think is it WHO, Shannon, that gets there's donations to match what the kids earn in points?
It's UNICEF, and I just want to acknowledge the Kids Boost Immunity, I Boost Immunity team, which is really responsible for the creation of the platform. But yeah, it's knowledge mobilization, and it's inoculating kids to misinformation. Thanks.
And it's got an international reputation now. And really, BC right now, we're in such a fortunate position that really we're the envy of the world. Public health in this province got it right. And people are looking to this province for leadership and models. So really, how do we keep building on this positive path? So Margot and Sandra, is there anything you would like to add before we move into the small groups?
Go ahead, Sandra, and then I'll come in if you wish after that.
Mm-hmm.
Well, just that coming together, collaborating is so important, and it just takes one step. It takes one person to reach out, and to don't give up. Don't give up. Sometimes there's so many challenges, but just step forward one day at a time.
Mm-hmm.
And thank you for all your hard work to date. Tabi Masai.
Yeah, and we're so, what we wanted to do with this session is to land, and it's so neat to see all of these ideas bubbling up, because we're interested in fueling your local actions. We've given story from our places and from our experiences. But the element here is this sort of landing our public health work and letting ourselves not just be thinking about, as we've seen in some of the chat boxes and ideas, not just thinking about the environment and the way in which the living systems we depend on, they're not just a source of hazards. The shift from thinking of these things as a source of hazards that impact our health to our home. And once we start thinking about our home, that the Anthropocene is our home, we're living, this is the characteristics of our home, where those things have deeply social, cultural, personal, and ecological. This is not an environmental issue. This is these are whole person issues. And so we wanted to leave, because of the nature of the conversation that's happening next, we wanted to leave you with that sense that yes, some of this will fit within your operational mandate as a public health person. Some of this will fit in your day job, and some of it you'll be able to ask whose day job is going to change because of this work. And we have to be able to answer that question. That's one of the really practical questions for public health to answer. How are our day jobs going to change because of this work? But that's not enough. And so in your breakout rooms, we're really excited about you thinking about not only your professional role or feeling the constraints of that, but what might be your personal role be, where you might be advocating or engaging with activism or contributing to other partners' work, other people that are doing the upstream work. We've got that piece, and then we've got our broader kind of organizational and societal context that we're all working in. So these kinds of ideas that are scrolling through here are very inspiring and will be part of the kind of conversation we want to head to, with as well as some little exciting prods there for PHABC and the public health community that we'll be riffing off, as I understand, as we come back into the final sessions this afternoon. So because we were so scared of our stories going on and on, I can't believe it. We've actually come in slightly under time. So I guess that there are some thoughts and things coming out into the chat box. But I think that probably it's time to benefit from everybody percolating on these ideas, landing things into the chat box, having a break, freshening yourself for your final breakout room discussions, because we're really looking forward to hearing what that brings back for us. So over to you, Teresa, as we put a wrap on this.
And thank you. I must thank my co-panelists. This has been such a joy. I was really exhausted at the end of the day when we met, and ended up laughing so much. I went home completely energized. And I think for the three of us, one of the things that I feel brings us together is the body and the place. So you, in your body, in the place that you are living, how do you bring these things together? How do you be the citizen, the professional, an organizational rep? And, learning from Sandra that maybe all of us need to be warriors, and we do all three of those roles. Because I know we agonize about what do we do, as a professional, just as a private person. I think in Northern BC, we've been challenged because you can't separate those roles. You can't not be a professional in your community, even when you go to a party. You're still your role. So we've had to learn how to navigate integrating competing roles. And I think we've got some neat lessons about that. And I think, Christina, we're going to hand it back to you.
On time.
Perfectly on time. Yeah, great.